Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're going to talk about a very, very important question that comes up a lot. And that is, will fillers in Sculptra hurt my potential facelift results? Guys, this is a very timely and important question because we're learning more and more and more about the impact of fillers and Sculptra and how they can not only affect the structure and cosmetic aspects of the face, but also how they can affect surgical outcomes. So you're gonna wanna pay attention to this, you're gonna wanna listen to this from start to finish because, as you all know, the use of fillers, use of volume augmentation, things like Sculptra, etc., are extremely common. Most of you who are watching this have probably used it or probably on a rhythm of using it on a regular basis. And it's important, like anything else in life, for you to understand what you are getting yourself into before getting yourself into it or before getting into trouble with those things. So there's some pretty negative consequences of using fillers and Sculptra when it comes to overall facial structure and secondary surgical outcomes that I want to go over. So, as you all know, we lose volume as we age. The loss of volume is something that happens starting probably in our 30s or so, late 20s, beginning 30s, you start to see volume shift. Most people love their face the most when some of that baby fat, that baby volume, that fullness goes away and you're left with a face that is a little bit more elegant, a little bit more structured. You see the cheekbones, you see the jawline a little bit more clear. That's typically in the mid 30s. People like that. That's all volume loss that's been happening from 20s all the way to 30s. Then what ends up happening is maybe it gets a little bit worse. The volume loss carries on. And then you get to a point where you're like, I'm starting to look a little tired. I'm starting to look a little drawn. And then you reach to your local medical spa, dermatology practice, plastic surgery office, whatever, and say, hey, I need some fillers. The typical areas that people get filler when they start to see volume diminishing typically is the cheeks, because the cheeks start to appear a little bit flat, and I'm going to talk about that in a second. And they also put it in areas like under the eyes, which is absolutely true. You do lose some volume in that area. However, in the cheek area, and this is something that took me a long time in literally treating, God knows, thousands of patients, putting filler in their cheeks, my own patients, putting fat in the cheeks as part of my facelift, etc., that I realized something very, very important. And that is the cheeks actually don't lose volume. They really barely lose volume. I mean, it's interesting when you really study young faces and you look at older faces, you see that the cheeks haven't lost a lot of volume. But what ends up happening is people start packing in this volume into the cheeks because the cheek starts to fall down. It starts to droop down. And then you get this kind of hollowing in this area we call a nasojugal fold or groove. And you start to see that in this area, and the tear trough, which is the hollowing under the eyes, kind of goes with that. So the typical combination is you put some filler under the eyes, and you put some filler in the cheek. But the thing with filler, the difference between filler and Sculptra, filler is hyaluronic acid. It's branch-chained hyaluronic acid that doesn't break down immediately in the tissue. So for example, if you put in natural hyaluronic acid into the face, which hyaluronic acid is all over our skin, our joints, everywhere, it's everywhere. If you put it in, the molecule breaks down very quickly, usually within 24 hours, and then your body's making more hyaluronic acid. But if you were to you take a syringe and put that into you, well, it's gone the next day. What good does that do? So through chemical engineering, you basically, bind chains of hyaluronic acid with other, sugar structures, etc. So basically what you've created is something that is durable, stays in the tissues a long period of time. So the hyaluronic acid fillers like, Juvederm, Restylane, and now there's like tons of them. I don't even keep up with it anymore because I don't do them personally. Those are the category of a filler. Then you've got Sculptra. Sculptra is not by definition a filler, it is a stimulator of collagen, right? So you inject it 3 or 4 times, spaced out every month or so. Then what it's doing is almost like a fertilizer that stimulates collagen. You're building collagen out. Remember, collagen, we lose it in our skin, we lose it in our joints, we lose it in this and that. we don't actually lose collagen in our, the structure of our face. The volume of our face is actually made up of fat. It's not made up of collagen. Collagen is, it's in the tissues of various parts of our body, but it's not the contributor to volume. But you're using Sculptra to do that. Now, a couple things here. So this is what it comes down to. And I'm gonna, for the moment, I'm gonna lump these together because I think it's important that even though they're different in terms of their mode of action, their consequences are literally the same. So here's what it comes down to. So as I said, you lose volume in your 20s and 30s, and then you get to your 40s, and then you're like, okay, but here's what happens. Right around the 40s, mid 40s especially, you start to get sagging in your tissues. So as your face starts to sag, mid-face droops, jawline droops, neck droops, now you're like mid to late 40s, early 50s. You've been putting filler into your face starting in your 30s, trying to maintain the volume that you had in your mid 30s, right? You're like, I'm gonna keep this train going. Like every 6 months, every year, I'm gonna put some volume in my cheeks, put some in my eyes, maybe put some in my temples, put some in my lips, on it goes. Before you know it, now it's like years have gone by, literally 5, 10 years have gone by. Now the face is starting to droop. Once the face starts to droop, this is where things get a little unhinged because you start thinking that you actually need more volume to support this sagging effect that's been going on. So you go more often, you put more, cc's of each of these fillers. Next thing you know, your face starts to transition from what it used to look like to a completely different look. And why that starts happening is because, remember I said, the cheeks don't actually lose volume, but you've been pounding volume in your cheeks year after year after year. Boom, 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 voluma, Restylane, Juvederm, all these things. These cheeks start to get fuller and fuller, yet your face is starting to come down. Now you've got a look that you've never had before because, rewind back to 30s, you had a soft cheek that was lifted, not a huge amount of volume, but just enough to where it looks fresh and pretty. But then that is gone and you've replaced it with these fillers as you've seen the changes happening over time. But guess what? You've been told the whole time, we're all part of this messaging system, being told that these fillers last 6 months, 9 months, maximum a year, and you gotta keep it going. But we've learned over the last 20 years, something strange. When somebody stops using filler after a period of time, guess what? They still look full. So years gone by, 2 years have gone by, they still look full. So people started catching on. They're like, wait a minute, there's something going on here because this should have gone away. It should have been back to baseline, but it doesn't. And MRI studies and ultrasound studies and this and that, all these different studies to show that filler that was placed even up to 5 or 10 years ago has persistence in the face. That's a problem. That's a big problem because not only is, the presence of the filler woven in throughout the tissues, how can you get it out? If it's not going away on its own, how are you gonna get it out? Second thing is what's happening the minute that filler hits the tissue, your body starts rejecting it. It's like, this is a foreign body, it doesn't belong here. Even though it's under the category of hyaluronic acid, it's not natural hyaluronic acid. Natural hyaluronic acid is single hyaluronic acid molecules, not a chain, that is basically meant to withstand the breakdown process and last for long periods of time. So what ends up happening is you're like, hey, this look that I've now transformed into, it's there, it's done. It's like because what has happened is at the tissue level, the inflammatory process that sets in the minute the filler enters the body leads to fibrosis and scar. Keep that in mind, fibrosis and scar. Fibrosis and scar, which is scar tissue, is basically layers and layers and layers of collagen, right? Scar tissue is just collagen. Sounds benign, except for scar tissue, generally speaking, doesn't go away. So now what you've got is cheeks that are effectively permanently full, fuller than they've ever been in your entire life. You've got, somebody's been putting it up in your cheekbones, have been putting it along your jawline, doing all these different things. Now you've got a shape change, and that shape change is unfortunately there to stay. Some of it will, like I said, some of the filler might do, a certain percentage of it will be there forever. So this is where it gets, tricky. now you're like in your early 50s, mid 50s, and you're like, wait a minute, I've been putting all this filler in, it's not doing anything, I'm still sagging, my jowls are still hanging, my neck is still sagging. Okay, it's time for surgery. Well, guess what? Your desire, your goal is to look the way you used to, but now you've got a permanent effective change to the shape of your face that you've never had before. So now when you do a facelift, or in my practice, I perform a vertical restore. You may have heard of it and you've seen it on these videos, but this concept is the same. You do a facelift, you're working with, a whole new tissue platform. Cheeks that are in places that it wasn't before, jawline that's fuller than it ever was. You've got puffiness under the eyes, you've got all sorts of stuff that you're contending with. And you've decided now after a decade or so to do, a surgical remedy. But you can never go back to your face when you were in your 30s, which unfortunately is what you want. It's what you envision. I mean, answer this question honestly to yourself. When you think about who you want to look like, you want to look like yourself, but you want to look like a 30-year-old version of yourself. You don't want to look like this morphed up version that doesn't have jowls anymore. So what is really critical about this point is that fillers and Sculptra lay a foundation to the face that is there permanently. We're all innocent and guilty at the same time. Innocent in the sense that, we sort of took the word of whatever literature, science, our thought leaders and the drug companies and everyone else that is kind of explaining how these fillers work, and it's all new. People are putting it, they're using it as alternatives to surgical approaches, and then 10 years goes by and you're like, something's going on here. That's about the time that I decided to quit using fillers for my patients who have any kind of sagging at all, completely stopped. And then, fast forward another 10 years, I'm dealing with the consequences of that on a daily basis with patients who, feel unfamiliar to themselves and have these issues to deal with. The moral of that part of the story is, if you're young enough to be listening to this, and I strongly urge you guys to send this to younger, people who are in their 30s and 20s or whatever, let them understand this process and how this works, because it's not exactly what the consensus understanding among the population is. It feels very benign to put fillers in. So you can prevent it by not doing it. Okay. Second, if you are in the position where you're actively doing this, guys, honestly, stop. Stop doing it as frequently, as regularly as you are doing it. You are gonna regret it in the long run. A little bit here and there is fine. Small amounts here and there is okay. But there's really just not a need for a lot of volume and a lot of volume on a regular basis. Even when I do a fat transfer, I'm only putting a little bit in a lot of different areas. I'm not putting a ton, and I mentioned I don't put it in the cheeks. Okay, so that's the story with the cosmetic. Now, let's talk about it from a surgical point of view. So as I mentioned, you form scar tissue and fibrosis. Now, as a surgeon, I'm in faces literally all week long, operating on faces. So I can tell you, and I'm not embellishing or patting myself on the back, but I'm an experienced surgeon. I've been doing it for 20 years. I'm probably one of the most experienced, facial rejuvenation surgeons in the world, in terms of both the number of cases I've done and the experience level that I have, etc. Those cases are tough. They're hard because I'm doing intricate dissection, meaning I'm separating tissues in a very, very delicate way, because structures like facial nerves and arteries and important structures to the face are literally like a millimeter or two below me in terms of where I should be and where those structures are. So when you have fillers and Sculptra, what ends up happening is you end up creating a layer of scar tissue that makes dissection more difficult, much more obscure, much more, the tissues just don't peel away the way they naturally would. They obscure the boundaries, etc. Again, because I'm experienced, because I do this all the time, and because I see this on a regular basis, I've grown accustomed to it. I mean, literally, I'm in faces all the time. Probably 80% of them have some filler or some, fibrosis from some volume and Sculptra and this and that, the other thing. It doesn't faze me so much. I know how to get get around and still perform a safe, uncomplicated procedure. But I often, regularly think about how the younger surgeon or the less experienced surgeon that does a lot of different types of surgery and does this every once in a while, and they take on a procedure like a deep plane facelift or something that's a little bit more anatomically technical. How are they managing this? Are they backing away, meaning that they're doing a sort of not as complete of a surgery because they're getting into all this sticky scar tissue and they don't want to proceed for safety reasons, which I think it's a good idea, just it's not great for the outcome. Are they pushing through, risking, things going awry? I don't know. Are they sweating it out, taking 2-3 times as long to get through the surgery? I don't know. I mean, bottom line is it's a lot harder. Every surgeon, colleague of mine that we talk to about this stuff privately and in forums and in our teaching seminars, we all share the same experiences. It sucks. It's no good, it's no fun. It makes surgery a lot more difficult. And when you think about it from a patient's point of view, if you're not getting the upside, meaning like you're actually not rejuvenating your face by putting all this volume everywhere, you're just changing it. And you're getting scar tissue, which making the surgery, which would actually make you look like the younger version of yourself, more difficult and less likely to be achieved. What is the point of all of it? It really begs the question, what is the point of all of it? Now, the other aspect of it, the third component of it is, let's say you get through the procedure and you get it all done the way you hope to. The presence of the filler from before nevertheless creates some lumpy bumpiness, some irregularities, some contour problems, in addition to the fact that these fillers absorb a lot of fluid, so there's a prolonged healing related to it. There's a lot of like fullness. So it's like all around, there's like very little win, a lot of losses. And I think I didn't appreciate it as much as I do now because like I said, it's like we're operating on people who've been doing it for 10 plus years in their faces. Back in the early days of starting to do fillers, I mean, it takes a while to get to these points. None of those patients in the early phases necessarily manifested this way. Now we're seeing it. So there really is no excuse at this point for injectors, and I'm calling out colleagues and nurses and medical spas and dermatologists and plastic surgeons. I'm calling everyone out on this. There really is no excuse to get this wrong at this point. Like, we know more now than we ever have. The evidence is more clear than it ever has been. Let's just face the fact that fillers are an okay tool and they're not a great tool. And they have no role in actually treating sagging and more advanced aging changes. So pretty much, in a nutshell, as a consumer, as a patient, think of it as, if you're in your 30s, you want to put a little bit in certain parts of your face that you've lost volume, fine, great. Stop doing it when you get into your 40s. Definitely like no role in it when you're in your 50s and above. I truly can't see a role in it. And no matter what age you do it, don't get into a situation where you're doing it rhythmically over and over throughout time. You're going to regret it in the long run. You're going to make the job of the surgeon who's going to operate on you one day much more difficult, challenging, and risky. All right, folks. So that is whether or not fillers and Sculptra can negatively affect your facelift, and I hope you understand the rationale and the why behind it and have a better perspective. Trust me, you'll be doing everyone a favor by spreading the word. Send this to a friend, send this to a family member. Let people understand this before they get themselves into trouble. Send it to your own doctors, your own injectors. Again, this is stuff that is not secret, shouldn't be talked about, whatever. We're talking about this. I mean, like I said, at our meetings and this and that, this is the stuff that we're talking and educating and teaching our own colleagues who attend these meetings about this type of stuff. And for me, I'm extremely passionate about educating you, the consumer, who's out there getting confused and pulled in so many different directions. So your own knowledge is the greatest power you can have, and being empowered is the greatest gift that I can give you in terms of my communication with you. So I hope that helps put things in perspective and you get something out of this. If you enjoyed this, hit like. If you're not a subscriber to my channel, make sure you subscribe to the channel. And if you have any questions or comments, drop them down below. Again, share with anyone. And until next time, Dr. Amir Karam, thanks so much for your kind attention.